Nicole, did you hit record? Hello, and thank you for joining us for Toledo Public Schools Virtual Family Cafe. Today is January 27th of 2021. This session is hosted by Toledo Public Schools Family and School Collaborative. We just want to start this session by introducing ourselves. My name is Alina Rodriguez, and I'm the Family Engagement and Community Outreach Coordinator for Toledo Public Schools.
My name is Nicole Shatterly, and I'm the Family Engagement Coordinator for the Early Childhood Education Program.
And we have some very special guests with us here today. I want to introduce Mrs. Kristin Bruce from the Zepf Center. So Kristin, I'm going to go ahead and stop sharing my screen so that you can share yours and tell everybody a little bit about yourself.
All right, thank you so much. Now, of course, I'm not completely prepared. Oh, wait, here we go. All right, I'm going to present. Give me just one moment. To figure this all out. There we go. This is going to make for a really great early part of this presentation. Here we go. All right, can everybody see that?
Yep.
PowerPoint? Okay, perfect. All right, so I am here with two of my colleagues. We are from the Youth and Family Services at Zepf Center. I did not have the right slide up there. My name is Kristin Bruce. I'm the Clinical Director of Behavioral Health Services at the Zepf Center. I've been at the Zepf Center for about 14 years now, and I help to manage and implement the adult therapy, youth therapy, and our intake programs at the Zepf Center. And I'm here with Dr. Jason Drummond and Renee Radford. And so if you would like to both introduce yourselves, that'd be great.
I'm Dr. Drummond. I go by Dr. Drummond, Dr. D, Dr. Jason, whatever. As long as it's nice, I'll respond. I've been with Zepf for about 3 years now. Yeah, 3 years. And I am our youth coordinator. So I run our youth therapy team and our child psychologist.
I am Renee Radford. I just go by Renee, and I am the clinical coordinator of the MST program. I've been here for about a little over 3 years alongside Dr. Drummond, and have been with the MST team the whole time.
All right, and thank you so much to Nicole and Alina for having us today, and to all of the TPS family out there. So what we want to do is just talk a little bit about our youth and family services. We're also going to throw in some general information about Zepf Center. And because we know that parenting can be difficult and adults need us too, we will go over some adult services at the end. So I'm going to start just with services provided to youth and families. So our youth department includes comprehensive mental health services. That's individual and family therapy. We have some group therapy, PCIT, which is parent-child interaction therapy, the MST program, also IHBT, which we'll explain a little bit more about in a little bit. We have a psychological testing program. So if we're looking for accommodations, kind of need support for accommodations in school, IEPs, 504s, we do a lot of testing there, sometimes getting effective diagnoses. We also have medical evaluation and management, which does not always mean meds, just meeting with an actual psychiatrist. We have case management services to help connect you and your family to resources. We also offer youth day treatment services, which are group services for kids to help build skills, and the ACT parenting group, which is adults and children together, talking about parenting skills and providing some parenting support. We have a multitude of locations. You might have seen us around town. Our youth services is located primarily at our 424 West Woodruff location downtown. We also have a youth homeless runaway shelter called Safety Net. We are the only the only youth homeless runaway shelter in the area. And that's at 2005 Ashland Avenue. We'll talk about that later in the presentation. We offer adult mental health services on Central Avenue in Toledo. It's the west side of town near Sylvania. And then 905 Nebraska Avenue is our downtown location. We also offer a wide variety of substance use services. We do have a wellness center. So we have groups for both adults and youth about nutrition. We offer exercise. We have a gym for our patients at our Collingwood Boulevard location. We do administer Ohio Means jobs. And so that is all about vocational support, finding help with finding employment, and then also Zepf Recovery Housing. So for folks who need additional support, adults who need additional support with living independently in recovery from a substance use disorder. So who is eligible for services? We serve anybody from ages 2 to 92 or older. And really one of the first things to determine eligibility for services is going to be to call our main number, 419-841-7701, and request intake to speak to somebody about your insurance eligibility. There are a number of other mental health centers in town if we do not accept your insurance, and we just want to make sure that everybody gets into the right place. We do accept all Ohio Medicaid programs. We do partner with tons of private insurance providers as well. A good place to start is always to call your insurance provider as well to see if they're contracted with us. And even if they are not, or if they don't fully cover your services, you may be financially subsidized by our local mental health board if your insurance doesn't cover anything. I always advise people just call us. We will try and answer your questions. I promise we are a helpful bunch. We will try and work with you. So I'm going to turn it over to Jason for the next few slides.
Sounds good. So we always get questions about when is an appropriate time to seek services. And there's never any problem with calling and asking, but we thought we'd list some things that are common reasons you might come in, but this is hardly an exhaustive list. Okay. But some of the things we look at are like if you have a child or adolescent who's having problem focusing in a variety of settings, whether it's in the classroom or at the end of the day, they even seem wiped out and are having trouble with homework. There could be various issues we could help with, from anxiety to ADHD symptoms and things like that we could look at and be helpful with. Anger that seems more typical than is typical for a child their age. Kids get angry just like everybody else. So just because a child gets angry doesn't necessarily mean they need therapy. What we're talking about is if it seems to be frequent overreactions, getting angry at very little things, not needing much provocation, staying angry for longer than you would expect, or being angry for large parts of the day. That's when it can be a little more problematic, and at the very least, it's worth consulting about. One of the things we talk about is frequent sadness, crying easily, withdrawing from others, not finding activities fun anymore. Those can all be signs that a child is depressed or experiencing minor negative mood that way. The one I like to throw out there too is it's not always the kids won't always tell you like I don't enjoy anything anymore, but you might hear that they're bored constantly. Now, all kids complain about being bored periodically, but if a child is bored, it seems like 100% of the time, and there's nothing that draws their attention. I mean, and we've got some of these other things going on with the sadness and crying or talking negatively about themselves. And it might be something to talk to somebody about. We also look at sleep problems that are more than periodic. All kids have nightmares every once in a while. Nightmares are more problematic. I consider them frequent when we're talking more than 3 or 4 nights a week and on a regular basis. Or you've got problems where they're sleeping fewer hours than you expected, or they have trouble falling asleep at night. They can't shut their brain off, those kind of things. And it's not just because like it's exam week. Exam week, we might all have trouble sleeping, but if it's more constant and over time, and when some of those stressors go away and it doesn't resolve itself, it's definitely something to talk about. After experiencing a range of disturbing events, from car accidents to seeing somebody get hurt, house fires, or things like that. Now, a lot of people are resilient and have no major reaction afterwards, and that's okay too. We're not going to pick on them for that, but especially if there are some of those changes in sleeping patterns, or you see more irritability, or they're clingy, or just like anything that's out of the typical from before. Sometimes it's useful to talk to a therapist and just say, hey, is this a normal reaction to what happened? And kind of monitor for a little while to see if it gets better. Frequent problems with peers, difficulty with arguing a lot, or not being interested in being around other kids, or even being ostracized and having to deal with that, finding ways to handle those kind of things. Those are things therapists can help with. And just kind of in general, any problematic changes in behavior that last more than a few weeks. Like I said, kids they have rough times too. And they get angry, or they have periods where they're more stressed out. And, as long as after a short period of time, it goes back to normal, that's fine. But sometimes if it extends on, or if it's interfering with like school functioning, or if you've got a teenager and it's interfering with their job, if they've got one, maybe it might be time to talk to somebody. The other one that's a little more long-term is any concerns about the ability to understand information and function independently. This could be from a range of things, whether it's they seem to understand most topics, but when it comes to reading it, that's really hard for them. Or they do a really good job understanding directions, but have difficulty expressing themselves verbally. Or they're just having trouble keeping up in class. That's one of the main areas we use testing for, is to see if there are differences in ability. If somebody maybe has some areas where they learn differently. And one of the things that's really common for us to find out is that perhaps a youth learns, has more facility for learning in one way than another. So for example, they're very hands-on and verbal information is difficult for them. Well, sometimes our psychological testing can help provide information about that, and we can give feedback on both how we can help out in the environment at home and in the office, but also at school. And testing can be used to kind of delineate between any of these problems and see if we can find, we call it gaining diagnostic clarity, trying to figure out what's going on, where some of the issues are coming from. So, the process for setting up an intake is pretty easy, or at least I like to think so. If there's ever any problems, just give me a call and we'll figure it out. But you call that same main number, the 419-841-7701, and option 1 gives you our intake department. One of our professionals over there will schedule an appointment for you and let you know what kind of paperwork you need to bring along. Right now, and for the foreseeable future, we're offering either virtual or in-person appointments. We can accommodate either way. So it's whatever fits your comfort level and your need. And once you talk to our intake specialist, they'll put you in the schedule of one of our therapists. So that first appointment you have here is actually with somebody from our therapy team. And I've got a wonderful therapy team I work with here. They're all great, wonderful, invested people. And so what they're going to do is they'll have a conversation with you that's an hour to 2 hours long, during which they're going to go over family history, get concerns, and talk about what kind of your needs are. And at the end, they're going to give you a tailored recommendations on what kind of things they think would be helpful. Are we going to talk about ongoing therapy with somebody? And hey, I got this great therapist over here who would work for you. Are we going to look at psych testing? Are we going to look at, talking to one of the psychiatrists about if medication would be helpful? And we can do them all at the same time. So we'll kind of make those recommendations at the end. It's important to remember when you're coming for that, we will need some paperwork. Big things are copy of insurance, identification, and if there's any custody paperwork, we'll need copies of that to do that intake.
All right, so MST is up. MST stands for multisystemic therapy, and we are certified in intensive home-based therapy. So that's a special training and certification that we have to have for the agency in order to provide that service. So it's more of a separate billing. So the multisystemic therapy program is our main program that we run. We call it MST for short. We work within the child's ecology. So we are in the home, we are in the school, we're in the community. We'll work with supports, family members, peers. We work with everybody while you're in our program. We have a 24/7 on-call. So that means you can reach a therapist from my team 24 hours a day, 7 days a week, holidays, weekends, all that. We are small caseloads. So each therapist carries about 5 cases. And that's because we're super intensive. We do a minimum of 3 hours a week with the family and the youth. And we're open from about 3 to 5 months. So it's pretty short compared to a lot of therapy. And that's why we're so intensive. We want to come in, get the behaviors under control, and then we'll kind of transition you out into whatever you might want. We do have special training to go through MST. There's a 5-day long training, and then we have trainings every 3 months on top of whatever the agency has. So there's a lot of work that goes into it. And we work as a team. So all the therapists know a little bit about every case. I know about all the cases, and then our MST consultant goes over all the cases with us once a week and is also available for support should we need some continuing education, or we're having, some struggles with a youth and not sure how to handle it. We have lots of eyes on cases, so we can all handle it together as a team. The biggest thing about MST is that we work with the entire family. We're helping the parents build social support to help with the behaviors. So it's not just always about the youth. Sometimes it's about helping the parents support, get support for them so they're able to deal with the youths and the stress. And, kind of using the whole family to come down and work on the problems. We want to empower the parents to address the needs of the family. They are in the house, they are the expert on their kids. We want to kind of give them the control back in their own home and help everybody kind of get along better and improve the whole family dynamics. And we really hope to help the family sustain those successes and improvements after we've discharged. So that's another reason why we work so intensive, the 3 hours or more a week. A lot of the MST youth that we treat is kind of chronic issues that have been going on for a long period of time, delinquent behavior, significant emotional problems. So some of those things on the list are like truancy and academic issues. So not going to school, low attendance, failing, having behaviors in the school that may lead to expulsions, suspensions, which kind of falls in line with the serious disrespect and disobedience. But that doesn't necessarily have to be in the school. That can be at home. That could be out in the community. That can be anywhere. Same as with the aggressive behavior. We see a lot of that sometimes between the youth and the parent, or the youth and the siblings, which is outside of the normal sibling, nitpicking, those types of things. Destroying property, punching holes in walls, throwing things that are, significant, and like I said before, chronic. Some of those things may have resulted in injuries or calls to the police. We also have the criminal behavior, which is anything that has led to charges with the juvenile detention center. And I'll kind of talk a little bit about that under the referral process. So that could be, breaking and entering, running away, domestic violence, assault, theft, anything, those are probably our most common behaviors. A lot of truancy as well. Drug and alcohol problems. We see a lot of youth who are involved in this when they are out with their peers. They're not supervised. A lot of marijuana use. We can address all those things. And like I said as well, the running away. The referral process for MST, we are funded through a behavioral health juvenile justice grant, which is down there. It's called BHJJ. And that means that any kid that comes through the court system or touches the court system is eligible for MST under that grant. So the assessment center, probation, misdemeanor services, and the family violence program would be all considered court. So if you have a child who is in one of those programs or has been there and you are interested in MST services, you can contact them and they will call me to make a referral. I'll help them fill out the referral. We'll talk about the case to see if the youth is appropriate, and we'll kind of work from there. Now, just because we're funded through the court does not mean we cannot take other referrals. Some referrals come from schools, psychiatrists or their therapists, children's services, community health, other agencies, Harbor, Unison, those types. We're working with the DART program or the Runaway program. I've even had insurance companies call me about getting services for a youth and their parents, and then parents as well. So if you're not sure, you can just call me or email me. And I think that information is on the next slide, which you cannot see the referral form, but that's okay. We can maybe add it in the link or whatever. That is my contact information, Renee Radford. That is my email. If you have questions about, if you might be eligible, or you have just questions about MST, if your youth might be have some of those issues, you can email me, or below is my work cell phone number, so you can call me as well. The online referral form, there is a hyperlink there, which we'll post in something else, but it is on our Zepf Center website. You can just go to services, and then a little drop down will come, and it will say youth services, and then it will say safety net or MST, and you can click MST, and the information is on there. And it also has the inclusionary and exclusionary information, which basically just tells you who's appropriate for our program and who's not. And I totally forgot to put on here that the ages are 12 to 17. So sometimes we'll take 11 years old if they're moving up to 12. And it's just because of the research from MST that works best with those youth. And then it stops at 17 because once they become an adult, MST seems to be less effective, and they transition into, adult therapy and getting things a little bit different in that way. So there's my information, and feel free to shoot me an email if you have questions.
Thank you so much, Renee. I'm going to move into talking about Safety Net and our youth runaway homeless shelter. So we have had the Safety Net Youth Shelter for about, I want to say 4 to 5 years. We are the only youth runaway and homeless shelter in the area. We do take up to ages 17. I believe the lowest we go is 12. And it is not meant to be a long-term living situation. The ideal is always to get some kind of permanent situation, whether that's reunifying the family, or helping with getting into children's services, getting into foster care, getting placed with a family member, something like that. Safety Net is open 24/7, 365, so we are open all year round. I will have contact information in just a second. For the youth who come into the shelter, we provide shelter, clothing, food, transportation to and from school, and hygiene items. And then we also do some assessment services to see if there are additional problems that may be occurring, mental health problems. We will connect We will connect the youth with our Zepf mental health services. And then we also work, if they're already connected with Harbor, Unison, or Renewed Mind, or another counselor or psychiatrist in the community, we will ensure that those services remain continuous as well. We do crisis intervention services. And again, the goal is really to work with the family to get the youth back to their home environment, or somewhere safe if their home environment is not safe. To access safety net services, or if you just want to call for more information, we are located at our 2005 Ashland Avenue location. On the side of our building that faces Woodruff Avenue, there is a very large, beautiful mural painted by some community members several years ago. And those are the shelter doors. There's a call button that you press, so you don't have to call ahead of time. You can come anytime, day or night. And then there's also a number at the bottom to call and speak with shelter staff. So we want to talk a little bit about what to expect from services. And I think I was going to actually turn this over to Jason again. So what to expect from our youth and family services when you come in the door at Zepf.
Okay. So after that intake I talked about earlier, depending on what you get referred to, there's several options. But so to get in front of one of our medical doctors for psychiatric services, right now we're running about 3 to 4 weeks from the time you get referred till you get in with them. Therapy, we've got plenty of therapists right now that we can start anytime you'd like. A lot of times you leave that first appointment with an appointment scheduled with your therapist, whether it's the person who did that intake or somebody else who they think is going to be a good fit for you. You usually walk out with that appointment for the next week or 2 weeks later. MST, we've been talking about, it kind of can vary depending on what's going on, but right now we're looking at about 2 weeks out for that service. And one of the things I forgot to put on there was psychological testing. Right now, again, that kind of varies by season and how busy we get. But right now, from the time you get your referral till you get in front of us to start your testing takes about, we're at like a month and a half out, 2 months, which is pretty quick in my experience. And then once we start testing it, it can take up to a month and a half to 2 months to get finished. We are doing some things right now to manage safety. COVID, just like everybody else is doing. But one of the important things for us was getting people back into the office, because telehealth, those services where we can connect with you at home, work great for some people. For other people, it works better being in the office. For some, we can even do like a hybrid where, if we want to see you every week, but that's a lot of travel, you're like, oh man, that's a lot of gas, or that's going to be hard to schedule. We can do like 1 week where we're in the office and next week we do by video appointment. So we got lots of flexibility here. But our safety requirements are, we just do kind of the common things. We do a screening when you come in. We check everybody's temperature, ask if you've had any exposure to COVID or any symptoms like coughing, things like that. When you're on site, we require everybody to wear a mask the whole time they're here, and we wear a mask the whole time we're with everybody. We clean in between all appointments, and we keep our lobby clean. If there's a seat where somebody was sitting, we go out and spray it down afterwards just to make sure we're doing everything we can to keep everybody safe here. And so that's allowed us to do offering in person as appropriate. But also we've got those virtual services. And MST is currently doing services in the home as well. They've got some safety procedures they do, but they're very similar, but they can come out to the house. And one of the big things we like to focus on is, and this is one of those kind of the picture some people seem to have, is that you're going to bring your child in, drop them off, we're going to have them sit on a couch and tell us about their dreams, and we're going to make everything better. So I like to make sure we know that we want families involved. Now, that's going to change based on the age of a child. Your 4, 5, 6-year-olds, we want parents are heavily involved. These kids, we're going to be sending home assignments, and we're going to be talking about ways we're going to use our words with the kids to try and help them make change at home and other environments. Your teenagers, we're probably going to have parents a little less involved, but I think it's still important to have parents involved and helping support and reinforce. And we've got plenty of things, lots of suggestions for things that we can do at home. And the reason for that is we really think we want to take a team-based approach. And parents, parents often feel like they're blamed for what's going on, and that's not what this is all about at all. What is, regardless of how we got where we are, our parents are the agent of change. They are the one who is going to help us help their child change. I can get your child to do wonderful in here with me for an hour a week, but for that to go home, we got to be practicing some of those things at home. So we want parents involved, and we want to work hand in hand with you to help facilitate this change. We're also going to work with the family and other supports. We'll reach out to schools. We love talking to teachers and saying, hey, we're doing this thing at home and mom's doing a great job with it. And it really helps Billy stay focused and helps him manage his emotions when he's getting stressed out. How could we apply it to the classroom? How would that be helpful to you? We work with other agencies like the Board of Developmental Disabilities and things like that, with family members. If grandma and grandpa transport to school every day and watch after school, well, we want them doing some of these interventions too. They can be helping us out. Putting a team around the kid is the best way to move issues forward and make some change. But also, just the big thing is communication is critical, and both ways. I want parents to be able to say, if I stop by in the lobby and I'm like, how's it going? You're seeing Susie over here. What are you guys doing in therapy? I think parents should be able to tell us, like, oh, well, we're working on this, this, and this. And that means we've got good communication going back on. I want you knowing what's going on. We may set up a place for especially older kids, some privacy where they can talk over some things and have a place that can be their own. But we also want parents to know what kind of things we're working on and where we're hoping to make change. The other thing is, one of the things we have to do is anytime there are any safety issues, we get the parents involved. So we want them to know that, we will always communicate if there is any kind of safety issue that comes up. And we tend to err on the side of caution there. And the other thing about succeeding is just like trying to keep those appointments, be as consistent as possible. And if it's not working, if the time's not working or it's hard to get here or we're having struggles, I have some of the nicest staff in the world. I'll go to bat for that. Just talk to them. We can move things around. If there's something that's making it hard, we can problem solve. We're here to help. You're never going to get yelled at for like an appointment having to be moved around or things like that. We want to help. We want to see. We want to get you in here. So talk to us about it and we'll work on it. We were also talking about like just kind of the getting some help for parents, and I think Kristin's going to talk about adult services in a minute here, but just kind of reflecting on, in general, in a normal year, think of all the stressors that go into parenting. There is balancing work and communicating with school and trying to help with homework and working with after school programs. There's facilitating meetings with other kids and getting kids to all their after school programs. There's just, sometimes just getting dinner on the table at night is stressful. So being a parent in general is stressful. And so we want to help with that. But in COVID land, it's been probably 10 times more stressful for everybody. There's daycare shutting down because of an infection, or there's certain programs aren't running. For some of our kids that need speech and OT, that's been really hard that they haven't been able to get into those because of some of the safety procedures we have to do. So any way we can kind of support parents, we want to be there, and we recognize this is hard and you're trying the best you can. So we're here to help you and be your cheerleaders and your backup and to help things go better for you. And with that in mind, we do have our ACT parenting group that is for parents who want to come in and get information on how like stressful situations can affect kids. And it's got a wide range of topics talking about the effects of like neighborhood stressors or other kind of stressors on kids and ways parents can help and kind of moderate some of those effects for us. So
Thank you so much, Jason. With all of that in mind, knowing that, parenting obviously can be one of your more stressful jobs among the many hats a lot of you wear, we did want to talk just very briefly about adult services as well. So we do serve the entire continuum of ages. And so some of our adult services include individual, couples, and group therapy. We also offer treatment for a variety of substance use disorders, and we offer a gambling treatment program as well. We do offer job seeking services through Ohio Means Jobs. We have an assigned JFS caseworker for our Zepf clients. So that might help you obtain and maintain Medicaid, obtain and maintain food stamps. You do have to be a Zepf client for access to that caseworker. We also have a variety of different kinds of groups for adults that might provide emotional support, again, nutritional or exercise support. We do have a smoking cessation group. We have a group for grief and loss, which I know a lot of us are affected by this year. And then a variety of wellness services. We do have the gym, and again, nutrition groups, smoking cessation, exercise that we offer. We do offer medication management. So if there's medications that maybe your PCP isn't comfortable writing, or you start to have some different kinds of symptoms, you want to see an actual psychiatrist, we do have psychiatric services. And then we do have case management services as well on the adult side to help, again, kind of connect to resources. So that is kind of a broad overview. There's probably a bunch of programs that I left out. Zepf Center does a lot across the continuum of care for our patients. I'm going to stop sharing my screen here, and was wondering if Alina and Nicole, do you have any questions for us?
I think my only question was just, I just wanted to reiterate how someone would get a hold of you if they were interested in any of the services that you offer.
So really the primary way would be to call 419-841-7701 and choose option 1. That is our intake line. So if you're pretty confident that you want to explore and kind of have an assessment and then see what kind of services we might have to kind of match up with whatever you might have going on, that would be one way. Me personally, you can call that same number, 419-841-7701. My extension is 1132. You can feel free to call me. I have family members, maybe you yourself aren't having problems, but there's somebody in your family who just started to have some mental health problems. They maybe aren't aware of it yet. And so I've helped people talk to their family members, given more resources in the community, suggestions, tips, reached out to that family member to try and get them in. We can do a variety of different things like that.
This was excellent information. Thank you, everybody. Thank you so much for everything you went over today. We really appreciate you being here and taking the time to spend with our families.
Thank you
everybody for having us.
Yes.
For having us. And I just wanted to do a quick plug. I know that you'll be posting on the website, but we will have an educational series as well, hosted by many of our qualified youth therapists. Dr. Drummond will be back to talk about autism within the next few months. And I think we have something about youth depression, co-parenting, and managing transitions between households if you're separated, and also using art to help kids cope.
Excellent. Thank you so much.
Thank you, everybody.
Thank you.
Thanks. Have a good day.
Thank you.